Today's Emerging Issues Forum is sponsored by Front Wave Credit Union.
Front Wave Credit Union fights for their members, those dedicated to country and community, family and friends, for banking, lending, saving, planning, dream big. They got you. They're Front Wave Credit Union, and they've been making financial dreams come true since 1952. Check them out at frontwavecu.com.
Good morning, everyone. I'm Scott Ashton with the Chamber. So before we get started, I'll just give you a quick overview of this morning's agenda. So first, we're going to have Leslie Yip representing the County of San Diego, giving an update on from the Health and Human Services Department on the vaccinations. And then Aaron Bizak and Amber Throughput will give the perspective from our hospitals. And then we have representatives from Genentech, Nizeli Dertsakian and Joaquin Castaneda, that will give an overview of the containment strategies used at Genentech regarding COVID. And after that, we will have our legislative reports. So with that, I'm going to, first of all, thank you to the county's Health and Human Services Department for introducing us to Leslie, our speaker today. Leslie is an RN who recently graduated from Azusa Pacific University and has been on the front lines of the COVID-19 vaccine process. She has an interest in public community health and has a bachelor's in public health from UCSD. And today she will bring us up to speed on the county's efforts in administering the vaccine. So Leslie, welcome and thank you for being with us.
Good morning, everyone. Thank you for the introduction, Scott. As Scott mentioned, I'm Leslie, and I'm one of the clinical leads with Champions for Health, who's partnering with the San Diego County with the vaccinations effort. And today I'll be giving you guys a short presentation on what we've been doing. So let me just share my screen. Let's see. All right. Can you all see the slides okay?
Yes.
Okay. All right, so, so let's see. All right, so this is just the title slide on the COVID vaccines, and this is just like, it's just been amazing being on the front lines, especially just graduating from nursing school a couple of months ago, and just like providing vaccines to like harder to reach populations so that we can have a better chance of going back to normal, whatever that means in the future. Okay, and then these slides are updated as of February 22nd. And as you all know, like with COVID, everything's constantly changing. So we're trying to provide the most up-to-date information for you all. Okay, and then here are some key terms. What is a vaccine? So basically it prepares your body to fight the disease faster and more effectively by producing antibodies. So that's basically what we've been doing. And like, we're so lucky to have this vaccine so soon, just compared to like other diseases that we've had in the past. So we feel super lucky to be able to provide that to like the harder to reach populations as well. And then I guess comparing that with like immunization, so that is the process of becoming immune to the disease. All right, and then here are some common myths about the COVID-19 vaccine. So one of them being that when you get the vaccine, you'll get COVID, and then, which is not true. The COVID vaccine causes you to test positive on the COVID-19 viral tests, and then people who have gotten sick with COVID will not benefit from getting vaccinated. So in terms of that, I know that some people who tested positive do come to our vaccination sites, and we advise them to wait 3 months to get the test or get the vaccine, just because their body has produced like antibodies from getting COVID. So then that's what we advise them. But if they choose to get their vaccine, it's not like a contraindication or anything. And then getting vaccinated will not help you from, or will not help prevent you from getting sick with COVID. And then receiving the vaccine will alter your DNA, which is not true. The COVID vaccines that received emergency use authorization in the US contain the live virus that causes COVID-19, which is also not true. Okay, And then why should you get vaccinated? So as I mentioned earlier, vaccines work with your immune system so that your body produces the antibodies to protect or to help you fight the virus in case that you're exposed. And like on top of getting the vaccine, you should still continue to wash your hands, stay 6 feet apart from everyone else, and wear your mask whenever you're outdoors. And if you're feeling sick or anything, we advise you to stay indoors in case that you get sick and then you potentially spread it to other people that you're around. Yeah, and then also getting your vaccine will also help you if you're eligible. And I'll go over the tiers that we've been going through with the county. Okay, and then, yeah, so like with vaccines, like every year, like millions of lives are saved due to the vaccines, like the flu vaccine and like all other various vaccines as well. And then as of now, the COVID vaccine is the most effective intervention that we have for COVID. And I had some statistics that I couldn't pull from my email, but I work for Sharp as well. And like we get these daily updates with like how many people are hospitalized with COVID, and like the numbers have gone down like drastically with the COVID vaccines that are like given out to employees and like with the population as well. Like I think we covered the 75 and up people, and then now we're working on the 65 and up. So it's like it's pretty amazing. And let's see. And then in terms of like the vaccine development and safety, here are some of the components that are inside the vaccine in case you guys want to like look over that. I'm not going to go over all the details, but mainly it's like lipids and like some salts and like some sugar. Like you can like Google it. I'm not going to go over all the details as to what are inside the vaccines, but when you do get the vaccine, we do ask questions whether you've had previous like allergic reactions to anything in the past, and then after getting your vaccine, you will be advised to wait either 15 minutes or 30 minutes, depending on your history of like anaphylaxis reactions or anything in the past. Okay, and then in terms of the development to like distribution, so with all vaccines, like they have to do like the preclinical trials, and then they do phase 1, phase 2, and then phase 3. And then it's like a whole process in order for it to be authorized to be given to the public. Okay, and then let's see, vaccine development and safety steps. So this is basically what I went over with clinical trials. They all vaccines have to go through this to test its safety, efficacy, and effectiveness. And then independent safety boards must monitor the side effects for safety issues during the trials so that they ensure that this vaccine is actually safe to give to certain groups or like even at the age groups right now. I know Pfizer is 16 and up, and then with Moderna, it's 18 and up. So they've been doing a lot of tests for that in order to come up with whether it's safe to give to adults. And then now I think they're still trying to do more research as to like what the effects are if they were to give it to kids, but I think they're still working on that. And then for the emergency use authorization, the vaccines must meet the standards of the US FDA. And if they meet the safety and effectiveness standards, it can be made available in the US by approval for emergency use, which is right now because we're in the pandemic. And then, as I mentioned, like there's still continuous monitoring for the vaccines to see like if they're if how effective they are. And then, but as of now, like the pros outweigh the cons for giving the vaccines. And then how the emergency use authorization works. So as of January, only Pfizer and Moderna basically got their approval to use in the US. I think right now they're still working on the Johnson & Johnson vaccine. Yeah, so like the following criteria that must be met for the emergency use authorization is that the product will be used for a serious or life-threatening disease or condition. Based on all the scientific evidence and like research, it's reasonable to believe that the product may be effective, and the known and potential benefits of the product outweigh the known and potential risks of the product. And there is no other adequate FDA approved alternatives as of now. Okay, and then with Pfizer and Moderna, so just like putting them side by side and comparing them. So with Pfizer, it's 2 shots and 21 days apart, and it's an IM injection, so it goes right over here in your deltoid. And let's see, so this one is the one with the 16 and up, and there is a 95% effective. And then with Moderna, it's 2 shots, so same thing, but this one's 28 days apart. And I believe with Moderna, there's like a 4-day window period, so you can get it like to 4 days earlier than the 28 days or 4 days after. But people are advised to stay as close as possible to their 28th day, which is like about a month. And then this is also an IM injection, and this one's for 18 and up, and there's a 94% effect. Okay. And then for vaccine distribution, so this is just an overview of how it works. So it has to go through like many committees and like just outlining whether this is like whether the pros outweigh the cons, and whether or how to distribute it as well, and like determining the phases as to like who should get it first and like who can wait and all that. So it's just interesting to see all of these phases come into play, because myself like and my sister, we both work on the front lines, so then we were offered the vaccine a lot earlier than my dad, who's currently waiting for it right now, but he's also working an essential job. So it's pretty interesting to see like, oh, like who should get it first, and like everyone thinks they're important in like their job. They're like, oh, like what about me? Like how come I don't get it? And it's just like there's this whole like protocol as to like, you know, which phase we're in. Like right now we are in a shortage. So yeah, I don't know how that's going to play out, but I'm hopeful that we can all get vaccinated soon, or if they come up with the other vaccines that are also effective, I think that would be really helpful for everyone. Okay, and then, yeah, so this is just another overview as to how the vaccine is distributed. And then, let's see, determining the phases. Yeah, so like I mentioned with the phases, so they allocate it as they become available to ensure that there's an equitable distribution. So like frontline workers should get it first, and then I believe it's after that, I think it's like 75 and up, and then because of the age and like other chronic comorbidities that make you more prone to getting COVID and like worsening symptoms. And yeah, so it's pretty interesting to read on that. And then, yeah, so as of January 23rd, only people in this phase counts. So they can only get the vaccine if they're 65 and up, and people in all of the phase 1A, which is the frontline workers, in the 75 and up. And then, yeah, so like in terms of that, it's like pretty interesting working with Champions for Health, because I've been going to the long-term care facilities. Some of them are like, I didn't even know they existed. I remember driving to Chula Vista, and it's like all the way like inland, and like I was just like, oh, like I didn't even know this was there. And like yeah, just like being able, I don't know how Andrew does all this work. It's like really amazing how he puts together all these different clinic sites that I guess people didn't even think of like reaching out to for vaccinations. So it's pretty cool being able to do that. And also I remember helping out at the St. Vincent in downtown with the homeless population as well. So people who are like 65 and up were able to get their vaccines. Okay. And then this is also a pretty cool website just to check your eligibility, whether you are qualified to get the vaccine. So I can also send these slides out. I sent them to Scott, so if he wants, if he can send it to you all if you don't have time or don't remember the website. It's pretty cool to check just to stay on top of it. You can also get notifications when your second dose is, so that you don't miss that window. It's advised, I mean, you can still get it like 6 weeks after your first dose. I did ask Andrew this question because I have a family member who tested positive after getting the first dose. And what do you do with that, right? Because with the first, in between the first dose and the second dose, if you get Pfizer or Moderna, it's still about 3 to 4 weeks. And if you test positive, what do you do during that time, right? So he advised me to tell my relative to wait those 3 months or checking with a healthcare provider to see if it's more beneficial to get the vaccine or just to wait 3 months to get it. Yeah, there's like all these like complications because you don't know if certain people like who have autoimmune diseases or whatever should get it even though they tested positive. So I think there's still ongoing research about that, and I think it's pretty crazy how this is all happening. Okay, and then in terms of preparing for the vaccine, so you're advised to like take it easy the night before to ensure that like the symptoms that you may get from the vaccine aren't related to like other activities that you've done. And then some common side effects are fatigue, headache. Some people do get a mild fever, but it's totally normal to have these side effects as long as it doesn't persist for more than 3 days. You're advised to check in with your healthcare provider so it doesn't worsen. And then don't take acetaminophen, which is like Tylenol or like ibuprofen, just to anticipate the potential side effects. That's not how it works. I had a lot of family members who were asking me about that. Like, oh, should I take Tylenol just like prevent a fever? And like, that's not how it works. So you're not advised to do that. And then when you do show up to your appointment, do wear your mask and stay 6 feet apart from others. They do have chairs where they have the observation room where they observe you for either 15 minutes or 30 minutes, depending on how you answer the questions regarding your allergies. And then all the chairs are usually spaced out like at least 6 feet apart so that you're socially distanced. Okay, and then while you're getting the vaccine, you'll have this vaccination card with the lot number and like the name of the vaccine that you got. And then, like I mentioned, you'll be monitored for like allergic reactions for at least 15 or 30 minutes. And yeah, so it's pretty cool. And you also get a fact sheet about the vaccine while you're waiting, so you can read on about that. And then after the vaccine, so let's see, with Pfizer and Moderna, so there's 2 shots, like I mentioned, but still continue to wash your hands, keep your distance, wear a mask. And I was also advised to wear a mask inside the house if you don't live with your family members. Like if you live, like I'm still in school. So like I live with some housemates who are also in school and you don't know where they go sometimes. So when I do feel sick or if they do feel sick, like we just try to like keep our distance from each other. We don't eat at the same time or like we wear a mask too. We're feeling some of the symptoms. And I also get myself tested weekly just in case because I am working on the front lines. And yeah, so some helpful tips. So yeah, so as I mentioned, you'll feel some arm soreness and some you'll feel tired. You might have a headache and some body chills as well. And then just have your doctor's number handy in case that these symptoms persist and you feel like something's not normal, then you can reach out to them. And then, yeah, so as I pretty much mentioned, but some of the signs and symptoms that are not likely from the vaccination are like the severe symptoms of COVID, like a shortness of breath, runny nose, or sore throat, loss of taste or smell. You won't get any of that. Normal symptoms are like the headache, fatigue, body chills. Okay, and then with the ongoing research, so they do document the number of allergic reactions that we've gotten from Pfizer and Moderna. So, or these are the ones that are like reported as well. So these are the data that we have. And then also like checking with your healthcare provider before getting the vaccine because they know your personal history a lot more. So then they can give you better advice as to whether it's better for you to get the vaccine or not. And then, yeah, so just like with the new virus variants, these can spread easily and lead to like more COVID cases. So then that's why it's really important to advise others to get the vaccine if you qualify in order to slow the spread. Okay, and then I mentioned these earlier, just like keep washing your hands, keep covering your face when you're outdoors, stay home if you're sick, and get tested. I know through the county, it's super easy. You can Google the San Diego County COVID testing, and there's like various sites. Some of them are walk-in, some of them are appointment-based, so it's pretty flexible and really easy to do. And then these are some helpful links in case you're interested in reading. And then, yeah, this one is just like this Swiss cheese model. I don't know if you guys have seen this before, but basically it's like an illustration that like, although there are like many layers of like defense that lie between like the different types of hazards, like, oh, like not washing your hands or like not socially distancing and like all that. There are flaws with each layer, but then when they are aligned, as you can tell with the first 3 slices of the cheese, that's when the accident can occur. So that's when you can't get COVID. So these are just like, this is just basically just saying that there is no one single way to prevent COVID. You have to do a lot of these examples right here. So in order to prevent COVID and like slowing the spread as well. And then how we can get involved. So you can check out this website. You can also, a lot of my friends are like posting on social media, you know, like just keeping up to date with the COVID vaccination and the efforts so that whoever's qualified should go get vaccinated. And with Champions for Health, what we do is that we have a certain number of doses that we're supposed to give for that day at that certain site. But let's say for some reason we have extra doses, then we try to get whoever we can around that area. That way we don't waste any of the doses, because with the Moderna vials, we can get up to 10 doses. And then sometimes we can even get up to 11. So then it really depends on the syringe that we use to draw up the vials. And if we have extra doses, might as well use them, because we don't want any of it to go to waste because of like all the phases and stuff like that too, because some people are waiting to get it and they can't get it. So I think it's really amazing with the work that Champions for Health is doing right now in partnership with the county. And that's the end of my presentation.
Thank you, Leslie. We appreciate the information, and you know, thank you again to the county for making this available and connecting us with you today, Leslie. So thank you. For anybody that would like to download a copy of this presentation in PDF format, Hannah did put the link in the chat, so feel free to do that. So we're going to move on to our next 2 presenters who have very extensive backgrounds in healthcare. So I'm going to just read a real short portion of each of their bios and then turn it over. So we have Aaron Bizak, who joined Tri-City Medical Center as the Chief External Affairs Officer in May of 2018. In his role, Aaron is responsible for the medical center and healthcare district's marketing, communications, governmental affairs, and community engagement activities. Amber Throughput joins the Scripps family in January of 2014 and serves as Senior Director of Government Relations. Amber is responsible for educating elected officials and regulators on the unique issues facing Scripps Health in alignment with Scripps' mission and the corporate priorities at the local, state, and federal level. So Aaron and Amber, I'll turn it over to you.
Thank you, Scott. And I'll just kick us off, Aaron, and I just want to thank the county. You know, thank you for your presentation today. It was wonderful, and I think just for everyone on this call, I see a lot of familiar faces. You know, our region and our county, we have a lot to be proud of with how the vaccination has rolled out. You know, the county reported yesterday that they've finished 100% of our skilled nursing facilities. They're doing a lot of really important work in the equity space. They've got 7 different vaccination sites and a new project, SAVE, which is piloting new ways to reach out to communities that have challenges with the digital divide, have challenges getting access to the vaccination sites. So I just want to thank you, Leslie, for your presentation, and just thank the county for the work that's going on right now. For Scripps, just as an update for where we are operating 8 vaccination clinic locations throughout the county. And then we're also rotating vaccination clinics at our 5 hospital campuses throughout the county. And then in addition to that, we are operating the fairgrounds super site for the county. And between all of that, so at our sites that we administer at our various facilities, we've done about 75,000 vaccines to date at our clinics. And then at the fairgrounds, we are at about 20,000, and we expect that number to continue to grow, but that's just sort of ballpark, so you have an idea of how many vaccines we've administered. This weekend, through our different locations, we have about 3,800 planned for this weekend, and as you probably read, we're really focusing on law enforcement right now, so we're thrilled and honored and excited to do that. I think I see Crystal on the phone. Just want to thank Supervisor Desmond and others for their interest and focus on getting law enforcement vaccinated. It's been a huge priority for Scripps and for our leadership. Our law enforcement are there on the scene. They are first responders. They're in the middle of all of these things. So we're thrilled and honored to be able to help vaccinate our law enforcement officers. And then just a note for all of you with respect to that, we also are getting prepared for the high risk populations that are going to be up in about a week or so. And so I know, Aaron, I see you nodding. I know you guys are too, and you guys have some really interesting and creative ways to reach out to some of these folks. So I look forward to hearing about that in your comments. We're in the process of sort of identifying at least our patients and putting together some information so that people understand if they fall into that tier and how they can get themselves prepared for being vaccinated. And then I have some comments just about overall, but I'll let Aaron chime in on the vaccine piece, and then I can chime back in after that.
Okay, thanks, Amber. Aaron Bizek here from Tri-City Medical Center. So Tri-City's been vaccinating folks in our community for a number of months now, and we are following a 3-part vaccination outreach strategy. So those 3 parts are a vaccination clinic that we hold at the hospital, a vaccination response team that we send out to the super site, and also a distribution hub, so creation of a distribution hub. That hasn't actually come to fruition yet, but we're in discussions about that. So on the first piece, the vaccination clinic, we've been vaccinating healthcare workers and people over 65 for some time now. We just recently, on March 1st, moved into the new category of vaccinating educators, law enforcement officials, grocery workers, informal caregivers, and folks like that. We do this, we have our own online registration platform. We don't use MyTurn at this point. So we have our own online registration platform that's found on our website. We have an entire web page, actually several web pages dedicated to COVID-19. And one of them is tricitymed.org/COVID-19-resources. And I'll put that in the chat when I'm done speaking. We do have a walk-in clinic, so people walk in, they go and they sit down in a chair, and our vaccinators actually move to them where they're sitting, so we don't have to have patients or people being vaccinated moving from place to place. We are doing this twice weekly for first doses, and so about 500 people a day for the first doses, but then several other days of the week we're doing second doses for the people who are returning that were previously at our clinic. If you come to our clinic receive a vaccine, you're automatically registered for your second dose. The average throughput time at our hospital is 22 minutes. And so that includes the 15 minutes of observation time. And so people have had an amazing experience. We've actually ended up with a lot of 5-star reviews on Google and Yelp as a result of this. I would say that we are somewhat of the best kept secret for North County. So it's a very good opportunity for folks to get in. And we've vaccinated over 10,000 people so far at our vaccination clinics. Again, we're not as big as some of the larger systems. We are a single site, and so 10,000 is pretty good for a single site of walk-in clinic. The second piece is the vaccination response team. So we've actually put together a team of nurses that we deploy to super sites, and in this case, Cal State San Marcos. We've been there since day one. We deploy 7 team members every single day to that vaccination site. And just to give you an idea, at our clinic, we vaccinate 500 a day with about 2 vaccinators. So imagine how many 7 will vaccinate at the super site in San Marcos. The only challenge that we've had so far really is the nationwide shortage of Moderna, or the backup of Moderna vaccine. We actually use both Pfizer and Moderna since they both became available through emergency use authorization. We have ultra low temperature freezer capacity at our hospital. We bought an ultra low temperature freezer last June in anticipation of the Pfizer vaccine coming out. We also were using Moderna and kind of shifting back and forth. We've now moved to only using Pfizer at the hospital and leaving Moderna and the Johnson & Johnson vaccine that's coming out now to other people who don't have ultra low temperature freezer capabilities. And so we did have a little bit of a delay with Moderna. So the folks who have received Moderna and are coming back for their second vaccine, they've been delayed by about a week. But as Leslie had indicated, even though it's 21 and 28 days, there is a bit of wiggle room there. You can go up to about 6 weeks. And so we're getting everybody in on time. The third piece of the distribution hub, this is a concept that we came up with, obviously being a bit removed from downtown San Diego and the location of the county. We have the ultra low temperature freezer, as I mentioned, for Pfizer. We've been in discussions with the county about the potential of using us as a distribution hub, particularly for smaller healthcare providers that maybe don't have the freezer capabilities or don't have the capacity to take 1,000 vaccines at a time, which is what Pfizer sends it out, and they send it out with 1,000 vaccines. And so we've been talking about the possibility of us receiving the vaccine for them and then distributing to the providers in smaller amounts. And so we're still in discussions about that. A lot of things will depend on how everything rolls out with Blue Shield is taking over the vaccine distribution statewide. It remains to be seen how that plays into the county of San Diego, which has been very, very successful at vaccinating folks. And how that plays out with not only the county, but also with us. So we will see as the weeks go by here.
I just want to comment on a couple of things Aaron said. I think that what's really important for everyone on the call to understand and know, if you don't already and you're not as close to this as we are, is how critical all of these really creative programs and partnerships are. We need to get needles in arms. So the mass vaccination sites and all of this other work is very important, but equally important is all of the individual unique programs for each of the communities that we serve, so that we're reaching the hard to reach folks. And so I think Aaron, some of the work that you guys are doing is extraordinarily creative and important. And there's, like I mentioned in the beginning, and also really wonderful things that the county is doing. So like I said before, we have a lot to be proud of in this region with how everyone is working together. I also wanted to just make a comment about the Moderna and the supply and all of that. And I think there's some questions in the chat. We're all the providers are vaccinating all the tiers. We're trying to do some unique areas to focus on certain segments so that we get them done faster. But again, all of the sites are vaccinating the eligible persons right now. But I would also add on the supply issue that Aaron mentioned. That is really our biggest hit. I think I heard the county report yesterday that as a result of supply issues, we're only vaccinating about half, if that, of what we can vaccinate or what we have the capability and the infrastructure to vaccinate in our region. Aaron, please correct me if I'm wrong on that one. But it goes back to supply. And on the Moderna piece, Scripps is in the same position. So we're doing Moderna and Pfizer at our clinics, but at the super site, we're only administering Pfizer at this point. And we too look forward to seeing how J&J works out. We have the storage capacity for the ultra low temperatures as well. But to Aaron's point, now that J&J is here with the ability to get those out into communities without having that added issue of the ultra low temperature, we have the ability to reach a lot of other folks. So we'll be really curious to see how, or excited to see, I guess is a better word, how that rolls out.
Thanks, Amber. And I noticed in the chat, a lot of folks are talking about educators and VIBA and things like that. So we, the second that we were able to start advertising this to educators, we have partnered with Vista Unified, Carlsbad Unified, Oceanside Unified School District, Miracosta, Palomar. We also sent this to Tri-City Christian. We sent it to the classical academies, all the groups locally, as well as law enforcement, to say, hey, if you have an opportunity, if you guys want to participate in this, you can. We're currently not on the county system. And so you can actually come to us pretty much at any time. And, the other County Office of Education uses a quartile system for high risk schools and things like that, which, can complicate things for some of the schools as they try to understand these things and making sure that some schools go and other schools don't. And so ours kind of provides an opportunity for folks to come to our site. And we've had a lot of very, very, very happy educators and law enforcement folks, as I'm sure Amber and their folks have had, just on a much larger scale.
You vaccinated my sister, who's a teacher at South O yesterday, and she was elated. And I have to say, for those of you who haven't volunteered at any of these sites, so please send me a note. You have my contact information, you have Erin's. We had at the Del Mar site, we had 9,000 people put in a request to volunteer, which is remarkable. But to Erin's point, it is joy. We deal with so much heartache and strife economically, mentally, and then clinically with respect to the vaccine, the COVID vaccine. I'm sorry, the COVID situation that we're in. I have a 6-year-old right here who's requesting my attention. Forgive me. But when you go to these vaccination locations and you're volunteering, it is just ultimate joy and a ton of fun. And Erin's throughput that he mentioned, I think you guys said your walk-up site is somewhere in the 20-minute range. We've got really good turnaround numbers at our sites too, and people are just grateful and they're excited. We've had people show up with pom-poms and fun hats, and it's wonderful. So we would welcome volunteers if any of you want to show up and help us at our vaccination sites.
It's funny, I would just quickly note that, so my team at Tri-City has been really actively involved in the kind of the front end of the vaccination clinic, outdoors and whatnot. We were working to get our auxilians, which are our senior volunteers, back to the hospital, but we had to get them vaccinated first. And so in between the time of them getting vaccinated and really last week, my team was kind of manning the front side of the vaccination clinic. And so you would see me out there driving the golf cart, picking up little old ladies in the parking lot and driving them up to the front and dropping them off. And it was funny because we had a couple people show up that it was actually a woman and her sister who were both in their late 80s, and they were walking through the parking lot and they were having a real hard time on their canes. And I pulled up next to them. I said, "You want to ride?" And I got them to go up to the front. And it turns out that they didn't have an appointment because they didn't have access to the internet. And so we actually have a phone number that you can call. And for anyone who doesn't have access to the internet and whatnot, it's 940-5544, 760-940-5544. And we will actually put you on a very short wait list to get in. And what was funny was that the next week I came to work, and in the executive's office, there was a box of Godiva cookie chocolates, and it had a note on it, and it said, "For the golf cart gentleman." And it was for me. It was for me. I said, "We're assuming you're the golf cart gentleman." And so I was able to spread the cookies. I actually didn't even get one of those cookies, but I gave them to all the folks on the team and whatnot. But it's just funny, speaking to Amber's point, of how incredibly happy people are to receive the vaccine.
Yeah, and if I could do we have another minute to just give a quick general COVID update, Scott?
Yes.
Okay, so just to kind of roll into that, just a quick update for everyone. I think you've all seen the numbers. Things are starting to look good again in the county. This is welcome and appreciated news. Yeah, knock on wood. It's welcome and appreciated news. I think though, I just caution everyone to really be diligent. I know you heard that from Leslie in her presentation earlier, but as I'm kind of looking at ours, we have all the right signs, but if you think back to late summer of last year, when we were really seeing and starting to feel good again, we were at 63, Scripps was at our hospitals, we had 63 COVID patients in-house at that time, and we really thought we were coming out of this. And then that was just before Halloween, and then we skyrocketed and at one point had 500. And more than the volume and the challenges that it poses when you have so many sick people is how all of our hospitals are set up. And I know we've talked about this on other meetings, so I won't belabor the issue, but just as a reminder, we have had hundreds and hundreds and hundreds of deaths of our San Diegans. These are family members, these are moms, dads, brothers, sisters, aunts, uncles, friends. These are lives that are lost to our community. And so we just want to respect and honor them. Also, it's been really hard on all of our healthcare workers to see this much death. They're not accustomed to having to experience this much death and this much death alone, because we aren't able to have visitors come into the hospitals. We're all working on our visitor restrictions, and those will likely be changing in the near future as San Diego continues to come out of these tiers. And so stay tuned for positive news there. But at the end of the day, it's really hard on us. So I just would recommend and ask that you stay diligent. We're excited about all of the progress here, but we're not quite out of the woods. And anyway, if you see any of our healthcare workers, show them some love because they need it. So thank you.
And food. They love food. Just
All right, Amber and Aaron, thank you both for the great update. It's really particularly encouraging to hear the progress that's being made with law enforcement and our educators. So just thank you again for the work that you're doing. We're going to move on to our next speakers, but if you do have any vaccination related questions, still feel free to put them in the chat, please. So next, we're going to have an update from one of Oceanside's largest employers. Joining us from Genentech are Nizeli Dertsakian and Joaquin Castaneda to share about their company's COVID-19 containment strategy. Nizeli is a general manager, vice president at Genentech, Oceanside Biologics Operations. She has been working in the pharmaceutical industry for over 20 years in various roles in organizations, mainly in leadership roles. Joaquin is a senior manager for local governmental affairs. Joaquin has been working at Genentech for 6 years and covers the facilities in Oceanside, Vacaville, Dixon, Hillsborough, and Louisville. So Nizeli and Joaquin, thanks for joining us this morning.
Thank you for having us.
Thanks, Scott.
And Scott, I'll share my screen for a brief presentation.
Yes.
Thanks. Okay, can you see it okay?
Yes.
Great, I'm gonna just put it in a presentation mode. There we go. Okay, so thank you again for having us. And it's actually a really good segue to talk a little bit about how we're utilizing all of the different strategies that Leslie also presented in real life situation at our workplace. And specifically, the presentation is a little bit geared towards the Oceanside facility, but I can also share that these are very similar strategies that we have deployed across all of our campuses. So a little bit about just Genentech in general. If you're not aware, Genentech has been and is known as the creator of biotechnology. We've been in the business more than 40 years, and really our remit here is that it's all about our patients. We're all about the science, breakthrough science, medicines, and reaching all types of serious illnesses, life-threatening diseases. In particular, for the Genentech sites, we have several manufacturing facilities. As Scott mentioned, Oceanside is one of the facilities. We also have a facility in Vacaville, South San Francisco, and Hillsborough. And these are manufacturing facilities where we actually make the medicines. Our mission, as I mentioned, is really around being the industry leader to deliver our innovative medicines, better outcomes for our people, our patients, businesses, and communities. And we take the part about the communities very seriously as well, and have been also trying to do whatever we can outside of just the Genentech, our operations, to bring as much of advancements, equity, diversity, and so forth, and help as well with the COVID situation across the community. And there were quite a bit of donations and monetary assistance that Genentech provided to the San Diego County, has been providing, and last year was also a record of how much we gave back to the community in that space. As I mentioned, it's all about our patients, and we have a really strong connection to the medicines and the patients, and on a regular basis, these are all the photos that, it's just a snapshot, of course, but these are all the things that we physically also visibly have across all of our campuses. It brings us back to what we're in the business for, why we do it, and why it's important for us to keep our operations running, and why we had to take some really conservative, drastic measures to make sure that our operations wouldn't be disrupted as the pandemic hit, and we knew that the business continuity had to still remain, because if we don't operate, we don't make the medicines, then the broader impact, of course, to society is much, much broader as well. It's not just fighting COVID, but it's also all those life-threatening diseases that our patients would not be able to have access to our medicines. So just a little bit about the Oceanside facility. We're on about a 56-acre footprint from the extensive facility or the landscape. About 7 buildings, really going back to the community space. It's also about being a responsible employer and making sure that everything that we do, from construction, energy, and so forth, it's all in the sustainable space as well. And in particular, at the facility where I work, we are making right now 4 licensed products, but we're also in the process of bringing in additional products to our manufacturing facility. And right now it's about 7 medicines, including Actemra, which has been used for COVID treatment for very sick patients. And we have about 500, 600 employees, including many service providers that we engage. And just as a quick recap, when we talk about manufacturing facilities, sometimes it's misunderstood, or it could be misunderstood that we are just, it's just the manufacturing operations. We're just the technicians that are making the medicines, but because it's really, we're a standalone facility that needs to operate pretty autonomously. I do want to call out that there's many other facets of our business that are included in our operations, including facilities and engineering, science and technology, quality, safety, health and environment officers, operational excellence, and so forth. So that's also some of the perks, I would say, that we bring to the county as well, because there's many different types of employment that we can offer to the people, to the community. So going to the cheese model, and thank you, Leslie, for already setting the stage here for me to just talk a little bit about our containment strategy and all the different things that we have done using this cheese model to ensure that our employees are safe and we're able to actually continue with our business continuity. And given that the medicines that we make are absolutely critical, life-saving, and any type of disruption there, of course, is going to impact the society health overall. So first thing that we've done is really identify the business continuity staff that has to be on site working on a day-to-day basis, and our part of our staff who can actually work from home. And we've all proven that this is obviously effective. We're all doing it, and have used technology in many different ways to really get us to be as effective and productive as we can. And then, of course, there's all of the personal hygiene, the masks, and the county regulations that we have instilled. It's in place. And it's actually working out really well as well. We do have a team that is a dedicated team. We call it our incident management team. That's comprised of myself and others, several others in the organization, that we used to meet on a daily basis. Now we meet on a weekly basis. And this is just reviewing comprehensively what's going on in the community around us, what's going on all the way to from the schools to the hospitals, what's going on in terms of our own facility as well, in terms of any positive cases, any disruptions to our business that we need to be thinking about, and also what's ahead of us as well. So if we know that there's some regulations or things that are coming down the pipeline, how do we prepare ourselves to make sure that we're ahead of it and we're taking the right preventive measures? And this team has been, I would say, probably one of the best teams that I have been working with. Everybody is really dedicated. We understand what we need to do. It's mission critical, and the results have been pretty astonishing in terms of the successes that we've had. We've had very few cases that we've had on site. Actually, I can count on less than one hand on the number of cases with so many employees and service providers coming in and out on a daily basis. And we attribute a lot of that to the measures that I mentioned. In addition to that, we actually have also implemented site testing programs where we have mandatory weekly basis on-site testing that happens for any of the individuals that we consider outside of even business continuity staff. Anybody that comes to the site at least once a week is required to go through this testing. We also monitor to make sure that we're actually staying compliant and people that are supposed to be tested are getting tested. And again, very high level of commitment from our people on doing the right thing, needing to do the right thing. And we don't necessarily have to enforce all of these measures in place as well, because just genuinely people coming into the operations on a daily basis know that people depend on them, our patients depend on them, so that naturally they're all doing the right things. Then lastly, just to complete our cheese model here, vaccines is what we have been diligently and continuously working on to make sure that our business continuity staff has access to the vaccines. We've had some successes in this space already with just the county opening up the different phases and ensuring that people just in general can now have access to it for our staff. And we've also been working with our government affairs and other officials to see some of that that vaccine distribution of how we can bring that to the actual physical location of the facility where we're at and administer it on site at the location. And part of that as well is just noting something about the way we operate as a site. We are a 24/7 operation. That's what our manufacturing operations require. So we have a lot of shift work as well that happens. So for our manufacturing technicians, especially that have to work in the middle of the night to continue with our operations, it's a lot of inconveniences to leave work to try to find vaccine centers at certain hours only, because that's the only time that really allows them to step out and take care of the vaccines. So there's just some I'll call it inconveniences. We know that this is important, but at the same time, we're really working through those to see how we can make the distribution of vaccines as manageable and as easy as possible for the employees.
I can add that we've been also working with our industry partners as well as local partners like Crystal and Desmond's office that really helped us in terms of better understanding the eligibility requirements and the eligibility categories as they're changing, and as the California Health Department changes the guidance and how that translates to how San Diego views them. Crystal, as well as some of our other industry partners, have been very, very helpful with us in terms of understanding that, communicating that out to the county, and ultimately being able to seek a qualifying tier for our critical business continuity staff, which we have achieved. And I cover a variety of different counties in California, and I must give kudos to San Diego that they are definitely leading the charge in California, especially from a county perspective, seeing how far that they have gone in their tiers. And just the effectiveness has been quite amazing. The other counties that I'm working with, they're definitely lagging way behind San Diego County. So kudos to everyone there.
Yeah, thank you, Joaquin, for that definite call out as well. And I'll just stop sharing at this point, if that's okay. And I do also want to just recognize the great information that Leslie just presented around just the education of why vaccines are so important and the different myths. And part of a lot of this as well has been a tremendous opportunity for us to educate our employees and bring a lot of awareness. And so I will definitely be using the information from today as well to bring it back and make sure that we're continuing on that awareness and the education, especially around the vaccines.
Thank you, Nizeli and Joaquin. We really appreciate you giving us some insight into the amazing work that you've done to keep your operations functioning properly. So thank you for your time. With that, again, feel free to still put questions into the chat. But with that, we're going to move on to our legislative reports. And first, from Congressman Levin's office, we have Kyle Crahill-Frolander. Kyle?
Yeah, thanks, Scott. Good morning, everybody. Just wanted to touch base first on the American Rescue Plan the Congressman voted for last week. That's President Biden's COVID relief bill. You've probably heard enough about it, kind of top line stuff in the media about, the specific things for vaccines and families. Oops, sorry, there's my alarm. But also importantly, the business support. So it has an additional $15 billion for the EIDL grants, and then another $7.2 billion for the Paycheck Protection Program, both of which programs were used heavily by a lot of local businesses to be able to stay afloat. So those are important to continue us through these next few months. And then importantly as well, for specifically here in our community, there was $25 billion for the Restaurant Revitalization Fund. That was based off of the Restaurants Act that the Congressman supported last year. We're still pushing for the Restaurants Act. That would be $109 billion. This is $25 billion that was passed as part of the American Rescue Plan. But importantly, that provides up to $5 million in grants for an individual restaurant, includes bars, breweries, tasting rooms. So that's really important. 1/5 of it's also set aside specifically for even smaller businesses, those that grossed less than $500,000. So that's really targeted to some of these businesses that have been hit by the slowdown in the service sector, and especially with tourism being gone. So we're really excited about those pieces that'll help our businesses. And then also, really importantly, the Congressman has been pushing hard for direct aid for local cities, specifically cities like ours here in North County that are really reliant on hotel TOT taxes, tourism that have been essentially eliminated due to the pandemic. So Congressman Levin's been fighting for that since the first stimulus packages were passed over a year ago. None of our cities have been able to get direct funding as part of those packages, but in the American Rescue Plan, Oceanside will actually be able to receive $33 million. And that is a significant ability to stop the cuts that would otherwise have to happen. And we're talking about essential staff, workers that provide the basic services for our city. And that has knock-on effects for our businesses, of course, those folks not getting that paycheck, not being able to spend it. So we're really excited to see that. The American Rescue Plan obviously was passed by the House. The Senate's working on it now. Obviously, we highly expect it to pass. On a party line vote, yes, but nonetheless, it's that relief we need. And after that, the next phase to deal with the public health and economic crisis is called the Build Back Better Recovery Plan. And that's focused on infrastructure and manufacturing investment. And Congressman Levin's working with his colleagues on that one to make sure that our local infrastructure projects are prioritized. We've talked a bit in the past about some of the efforts to make sure that the railroad tracks that are on the Del Mar Bluffs are secured. Congressman Levin's been able to secure, tens of millions of dollars from the federal government to stabilize the tracks there. There was actually just another collapse this last weekend. But what the real long-term effort is to relocate those tracks, and that's going to be a multi-billion-dollar effort regionally, with Sandag and NCTD. And so we're hoping that this is the opportunity to get federal funds to be able to make that happen finally. Because if those railroad tracks, you've seen them if you've ever gone down the train, if they were to fall into the ocean, if there to be a bluff failure that actually closed the rail corridor for a significant period of time, it would cost the region hundreds of millions of dollars. It's not just people that travel along that rail corridor. It's huge amounts of commercial freight. I think it's something like 25% of all new cars on the West Coast come through the Port of San Diego and go up on that rail corridor. So this is significant economic importance. So in general, the Congressman's really pushing to make sure that all the shovel-ready projects that are here in our local area get included for funding, or eligible at least for funding, as part of the Build Back Better plan. And I'll close with the Congressman announcement. The Congressman is back on the House Veterans Affairs Committee, which he's very excited about. And he was actually elected by his colleague to serve as vice chair of that full committee. And he's still also going to be having the gavel as chair of the subcommittee on economic opportunity. So it's going to still be able to get out there fighting for those who serve our country, getting legislation done that we need. And with that, I'll turn it back to you, Scott. Thank you.
Thanks, Kyle. Appreciate the update. And we'll skip over to Crystal from Supervisor Jim Desmond's office.
Good morning, everyone. Crystal from Supervisor Jim Desmond's office. I don't have to do a COVID update because I think that was, vaccines were covered very well by Leslie. So thank you, great presentation. And then also Aaron and Amber did an incredible job. And I'll just say from a personal standpoint, my mother received her vaccines through Tri-City and she gave them A+++, pluses, lots of pluses after it. She was very excited about how well that went, and she has friends doing the same thing. And I have two very good friends who did standby vaccines on Monday at Scripps, and we're very pleased with how well that went. So I can just say that our medical professionals in San Diego County are outstanding, and they do a superior job of vaccinating people. And I can't thank them enough for the hard work that they've been doing. The supervisor has tremendous amount of respect for what our hospital systems have had to go through over the last year. And it's just incredible to watch you guys rally together and work together and service our community. So thank you, and thank you. Beyond COVID, the supervisors had a board meeting, 2 board meetings this week. On Tuesday, Supervisor Desmond approved community enhancement dollars. He has more than $173,000 going to Oceanside for different nonprofits in Oceanside to help with funding gaps and programs that they're working on. That was our first round, so there'll be more to come. So we love watching our nonprofits thrive in Oceanside, and we appreciate the work that they've been doing through a very difficult year. Also passed to create a plan for public safety shutoffs. So our partners at SDG&E, when they need to do power shutoffs during Santa Ana's or other major wind events, to make sure that we don't have devastating fires. There's some unintended consequences, like signals that don't work, or people that live in more rural communities that don't have the ability to have life-saving medical devices that they need. So we're creating an infrastructure plan and funding source to make sure San Diego County is helping close some of those gaps on infrastructure losses during power shutoffs. So that was good. I put in the chat, and so I'd love to hear that our educators can go to our medical providers for vaccines. We've had a lot of very frustrated educational staff that are in the classroom currently working, but cannot get vaccinated because of the system of how they're rolling that out. So it's a great resource for educators who have been in the classroom educating, especially our special needs teachers and assistants. So I'm excited to hear about that. And I think that is it. I'll put my information in the chat if anyone has any questions or needs help. Oh, and Joaquin at Genentech, who's my favorite pen pal. I know it's been frustrating to try and figure out where you guys fall in the tiers for vaccinations, and the chamber did a great job connecting us, and hopefully that was helpful to you guys. But we love Genentech. We like to keep people healthy and safe and at work. So thank you for the work that you're doing.
There's a question in the chat from Joaquin about, is there an estimated timeline of when phase 1C will start in San Diego? I don't know if you would have that information.
You know what, I do not have when phase 1C. I know there's been some struggles with the Moderna vaccine, and hopefully we will kind of catch up on those. We are prioritizing people that need second doses with the Moderna vaccine. We're hoping with the Johnson & Johnson shipments that we should be receiving soon that we can more quickly roll through these phases. Scripps has done an incredible job getting through law enforcement, so working through that tier, so we're moving quickly through the tiers, and the fact that educators have been assigned to VIBA, and so those are being handled, most of them, through that. I think we can pretty quickly, I think the goal is to have everyone vaccinated by middle of the year. So I would assume 1C will come up pretty quickly, as long as we don't have any delays in shipments. But I will definitely I'll have the supervisor ask at his next update, get an answer, and I'll email you.
Thank you, Crystal. Appreciate the update. So back to Chris Marsh from Senator Bates' office.
Thanks. You'd think after a year of this, I would know how to work a Zoom application. Apologies for that. So I wanted to first start off by talking about housing grants. Senator Bates is very happy to announce at the beginning of this month additional housing grants to help both San Diego and Orange counties through the Department of Housing and Community Development. There's the No Place Like Home grant, which provides funding for permanent supportive housing for persons who are in need of mental health services and are experiencing homelessness, which obviously is a huge challenge for our area in normal times and an additional challenge through the pandemic. That is $12,262,010 for rental projects here in the county of San Diego. Additionally, there's the Transitional Housing Program, which provides funding for child welfare service agencies to help young adults between the ages of 18 to 25 years old to find and maintain housing. Here in the county of San Diego, that grant was for $480,000. Additionally, there is one project that's in our district neighboring you guys here in Oceanside. City of Vista received $408,882 for the permanent local housing allocation, which is funding for housing-related projects and programs to help navigation centers and emergency shelters. So that's great help that's on its way. Additionally, Senator Bates has authored a bill, Senate Bill 668, which will seek to delay a portion of Prop 19. Most voters weren't aware that Prop 19 also repealed well-established protections from tax increases when property is transferred from parents to children. This measure would help delay part of that so that these families can make plans for those property transfers on their tax bill so they don't get caught with their pants down, so to speak. I'll have more on that, more information on that bill next time we meet. Today is a really important day up in Sacramento. Senate will be hearing Senate Bill and Assembly Bill 86. They have the same number, and that is the bill that will help schools reopen. Obviously, it's a huge issue. Senator Bates has reached out to all of our school districts to receive some of their thoughts and concerns about AB 86 in the run-up for today's floor vote. Right now, I think the senator is looking to support the bill, obviously, because getting schools open is the highest priority for the state. However, I think she wishes the bill was a bit stronger, so we'll see how that goes today. But again, she has been in contact with all of our school districts, and we've received some great insights into the challenges they face in reopening so that she's prepared for that fight today. Senator Bates has also authored Bill SB 511, which would help increase the accuracy of our voter rolls. This bill would allow for counties to sync up jury data with voter rolls. So, for example, when a jury summons is returned undeliverable, this bill would allow for that information to also be transferred over to our voter rolls to make sure that they are up to date and accurate. And lastly, I wanted to mention, and this is kind of interesting what Aaron was saying about some of our low-income families not having internet access to be able to sign up for the vaccine. Senator Bates has authored Bill SB 732, which would provide broadband for all, a bill to digitally empower all Californians. This bill would create a voucher program administered by the California Department of Education to help low-income families receive broadband, not only for instances like what Aaron elicited, but also distance learning has been a significant challenge for low-income families during the pandemic as their children are at home and not be able to access internet or even fast internet to create equity in their education. So Senator Bates is looking to fix that issue with this bill. So that's the end of my report, unless you have any questions.
Thank you, Chris. Appreciate the update. Councilmember Rodriguez, can you give us a brief update from the city of Oceanside?
Yes, really quick. This next council meeting, 6 days from today, March 10th, myself and Councilmember Jensen have a couple council member agenda items. The most important one, especially for the business community, is we're going to discuss Oceanside's growing homeless crisis and direction to staff to take emergency action to bring relief to impacted communities. So I've left this open-ended. I've left this, open so that the council can make decisions and give staff clear direction of what we want. The last 2 years I've been elected, it's been an uphill battle to really get any movement or traction on what Oceanside needs in our backyard to really start mitigating the homeless crisis, both helping the families and the compassionate side, but also, the ability to enforce our illegal encampment laws, to enforce our laws surrounding illegal activities that are just devastating communities. And so I encourage every single business owner that has been impacted in one way or another, or Oceanside resident that's been impacted, to please weigh in, tell us your story. And it's time that we stop talking and take serious action to relieve this. So some of the items I'm going to be proposing, I will be doing a webinar most likely Monday to answer questions and address some of these concerns. But right now, our police department is not able to enforce illegal camping on public property or public right-of-ways because we don't have a shelter. And so if we open a shelter, we have the ability to enforce those and ask them to move on or issue citations and move in that direction. The problem is, if you open a shelter, there's a lot that goes with that. So we want to make sure if we do open a shelter, that it is set up in a way that an individual can get the help, transition in, and there's a government dependency established in the beginning, but they must be on a pathway to being self-dependent. And so, our numbers are showing about 80% of the population have the ability to get off the street and move on a pathway back into society, being the best they can be. And then there's about 20% that they whether they have schizophrenia, they are physically or mentally disabled, those individuals, really, we have to focus on the housing first model. And so we're going to make some really important decisions on the 10th and give clear direction to staff. And so I would love every business owner to really weigh in on that and support our efforts to finally take emergency action on these on the homeless crisis.
Thank you, council member. And if you do hold that webinar on Monday, please get me the information as soon as possible, because I know we have a lot of business people that are very, very concerned about that issue.
Absolutely.
So thank you. We have a couple minutes. If anybody has like a brief 1-minute update from their organization, we can do that.
Scott, I could briefly. John Osborne, Director of External Affairs for AT&T. We are looking at the state legislature. There's some 30 bills in regards to broadband. And so we're evaluating those carefully. I know Chris mentioned one as well. Just the homework gap and the broadband gap, particularly in rural and low-income communities, is a difficult problem to solve, particularly on the rural side, because it's just not cost effective to put landline infrastructure out there. So just wanted to mention that was out there. We'll be evaluating those. If there's anything we'd like to bring back for chamber evaluation, that we'll do that. Also, Scott, I had a question for either Amber or Aaron. Was wondering what the opportunities are for standby appointments or walk-up appointments for unused vaccine at the end of the day. Is there a process for that?
I can address it at Tri-City. So we don't do this like the hang out at the front and wait for a standby appointment. What we do is if somebody comes up, we can put them on a wait list. And so we take down their name and number and their birth date and things like that. And then what we do is we go through the wait list at the end of the day if there's any additional vaccine and they come in. And then the other thing that we do with that wait list is we hold aside a certain amount of clinic appointments, every single clinic, that we use for people who maybe didn't figure out how to do it online and stuff like that. And then we call them. So I haven't heard of anybody waiting longer than a week to get in.
Thank you.
And I don't know about Amber. I don't know what her process is. So
I don't think she's on the call anymore.
Okay.
Any other quick updates? All right, so with that, I'll let you know that our next meeting is going to be on April 1st, and we will be getting our annual update from the U.S. Chamber, which is always very informative. Jennings Immel, who many of you know, will be here with us on the Zoom call. And again, that is Thursday, April 1st. So
Is it really April 1st? Is it really? Is it really?
It really is. I'm not fooling.
Okay. Just want to make sure.
So with that, I do want to thank all of our speakers for spending their time with us today to just bring us such great information. So we're grateful for your time. This will be on the Chamber's YouTube channel within the next week or so, and you'll be able to share it with others who were not able to join us today. So again, thank you everyone for being with us, and hope you all have a great day.